I'll often get asked what the recovery time is from a hair transplant, and I'll approach this from two different time frames, both short-term recovery and a long-term recovery. The short-term recovery is essentially a week. Someone can expect a week of scabbing in place of the follicles that are transplanted. They'll form small scabs. We will have you wash those off in a way that we would instruct you to every other day for the first week. Eventually, those scabs will fall out, and you should go back to looking like you had before the procedure after approximately 7 to 14 days. At that point, there should no longer be any further scabs in place of the follicles that were transplanted. The follicles that are actually transplanted, then meaning the hairs that are put in, will then fall out. And they fall out within that time frame, within the first few weeks after the procedure. And for the first 3 or 4 months, you at that point really don't notice anything in the recovery because the hair takes that long to grow. So essentially, with a hair transplant, we're actually transplanting the stem cell, if you will, in the bulb of the hair follicle, and that is what produces the hair. And that hair will start to grow after about 3 to 4 months. Again, this all depends on the person, but that's about the average recovery. And then at that point, it takes about 10 to 12 months to see the full regrowth of all the follicles. So in all, I would say about a year to see the full results from a hair transplantation procedure.